The system that we use for billing is set up so that we get paid appropriately for the work that we do. And understanding the details of that and understanding how that process works enables us to be reimbursed properly. Nobody's out to get the most and to bill for 40 events in a day, but we should be paid appropriately for the work we do. So I think the first thing that people need to do is understand the rules and the mechanisms by how the codes are developed, and what we need to do to be able to turn that appropriate code in, whether it's to Medicare or whether it's to a third-party insurer. I think there's a lot of also a lot of misunderstandings about the difference between how to bill based on intensity for the number of things you're doing versus to bill based on time. Traditionally, physicians and advanced practice nurses have been reimbursed for things they do, not things they talk about. I think we're moving a little bit away from that with the new CMS regulations. We're now going to be better reimbursed for talking about things and helping patients and families process their underlying struggles and questions and help to educate them so they can make good medical decisions. When I first started to learn about billing, I believe I was pretty ignorant. And if I went into a room and I spent time with the family and I came out feeling just absolutely exhausted, like that was the hardest conversation I've ever had in my life, I would often think I ought to bill for the real high level of code because that was really hard on me. On the other hand, if I went into a room and I was juggling a PCA, pain medication infusion, along with other medications for anxiety and dealing with somebody's nausea, and I came out of there saying, I can do this, this is no problem, this is just basic science, I thought that was easy, and so I would bill for the low level. And what I found is that's completely wrong. It's not about how it feels to you on the inside, it's truly about how much you're doing for the patient. And I think that's a little hump that we have to get over.